Hi, everyone. Welcome to Dean's Chat, where we discuss all things podiatric medicine. My name is Dr. Jeffery Jensen. I'm the Dean at the Arizona College of Podiatric Medicine and host for the Dean's Chat podcast. Today, we are going to discuss board certification, specifically certification through the American Board of Foot and Ankle Surgery. My guests today are both on the board of directors for the American Board of Foot and Ankle Surgery, and throughout the discussion today, we'll probably call it ABFAS, just with an acronym. So at this time, I'd like to introduce Dr. Jeffery Giesking, the current president who joins us from Menominee, Wisconsin. He attended the Des Moines University College of Podiatric Medicine and Surgery and completed his 3-year surgical residency training at St. John's North Shore Hospital in Michigan. Also joining us and fellow board member is Dr. Diana Rogers from Lake Bluff, Illinois, but she'll soon be moving to Gainesville, Florida to start a new position. But you should wait till the weather calms down in Florida.
Just a little.
She attended the Barry University School of Podiatric Medicine and completed her 3-year surgical residency training at Westside Regional Medical Center in Florida. Welcome to Dean's Chat, Dr. Giesking and Dr. Rogers.
Thank you, Dr. Jensen. I'm super excited to be here.
Well, I'm super excited that you're both here too, because this has been a long time coming. We've put it on the books and we've, all of us had tough, long schedules. So I'm really excited we're able to do it now. So in keeping with the Dean's Chat theme, I thought we'd go with first names only, if that's okay with you. And Diana, I hope, it's Jeff and Jeff. So I can't get
a little tough.
Well, there you
Sounds
go.
Good.
Sounds good. All right. Well, what I'd like to do, we're going to spend a lot of time talking about board certification, but I thought we'd set the stage by kind of giving your individual stories, your journey into podiatric medicine. Jeff, what led you to the Des Moines College of Podiatric Medicine? And Diana, what led you to Barry University? And Diana, if you wouldn't mind starting, we'd love to hear your story.
Sure. Mine's actually a little bit of a zigzag. I was one of those that didn't know what podiatry was. I had no clue what a podiatrist. I was one of those that often got it mixed up with pediatrician or proctology, believe it or not. So I was actually an athletic trainer for several years prior to going back to school. And during the summers, we would often work in orthopedic clinics. So I would work side by side with the PAs. And throughout my years, I started getting a little frustrated with the way that I saw the surgeons that I was sending my athletes to. I was getting frustrated with, I don't want to say their treatment, but their lack of post-operative care. So I started getting this bug in my ear that I would either become a PA or go back to do orthopedics. And I did some more shadowing of the PAs, and I went into surgery with a foot and ankle orthopod, actually, down in South Florida, and started watching surgeries. And I just kind of became enamored with it. I was still doing athletic training, but I was really spending as much time as I possibly could in the orthopedic clinics. So I got a wild hair up my tushy and I decided to apply to medical school. So I did. And actually I got in. So unlike a lot of the other stories that we hear, I actually did get into allopathic school. And in the weeks leading up to school, I happened to meet some medical students and we were all chatting and, the whole get to know you thing. And, they were 3rd and 4th year students and trying to mentor. And we're going around the group and we're introducing ourselves. So I say who I am. Hi, I'm Diana Rogers. I'm 28 years old. I'm a Virgo and I like long, walks on the beach. And oh, by the way, I want to do foot and ankle surgery. So it was like crickets. All of a sudden they were like, wait, what? I said, what? And they said, well, you're a female. I'm like, last I checked. And they said, you're 28. I'm like, what does that mean? And they said, well, you sure you really want to do this? And I said, do what? I still don't understand what you're saying. And they started explaining the long road through orthopedics and less than 1% of 1% are females, work-life balance, things like that. And they said, well, if you want to do foot and ankle surgery, then why don't you go to podiatry? And I was just taken aback. Like, what is this podiatry thing? Like, I have no idea what you're talking about. And I'm a little discouraged because 20 years ago, the female, strength and movement wasn't the same as it is now. So I was a little defensive and like, who's going to tell me I can't, go to school to be a foot and ankle orthopedic? So they recommended I go visit a female orthopedist. So I'm really upset to say the least. And I happened to go out that night for some drinks and some happy times. And I run into a colleague that I had done my athletic training hours with. And unbeknownst to me, he was in podiatry school. So I'm asking him how athletic training is going. And he's like, I'm not an athletic trainer anymore. I'm in podiatry school at Barry. So I'm like, what are you talking about? I'm like, you will not believe this week I've had. How is this even possible? And he's like, look, he's like, why don't you come to school? I'll introduce you to the dean. At that time, it was Dean Evans, before you got there. And I met him. I had met Dr. Siegel, who was the assistant or associate dean at the time, and kind of got excited. So that same week, I went and spoke to a female orthopedist. And to say the least, she really wasn't happy. Divorced twice, kids, just big old mess. And she just really did not seem happy. And she wasn't really doing the surgery that she wanted to do. That was going to most of her male colleagues in the same practice. So things are starting to kind of click. And I'm like, man, this podiatry thing kind of sounds great. So I go home that day and I happen to live next to a podiatrist. Well, I think Jeff knows who that is. So without saying his name, the entire time I had lived next to him, this was now going on 6 or 7 years, I thought he was an orthopedist. So he had his big cars and his big boats and his, scrubs. And he always came home and I always saw the orthopedist in the area that I knew at his house. So I just assumed he was an orthopedist. So I'm outside and I'm looking through the brochures for Barry. I'm trying to figure out my life. And he looks over the fence like, hey, neighbor. He's like, how's it going? And I'm like, oh, I'm thinking about going to medical school. He's like, oh, really? So he tells me he's a podiatrist. And I'm just blown away. This is now 3 times in a week and a half that somebody's mentioned podiatry. And after I get over the shock and awe that he's a podiatrist, he's like, why don't you come shadow me? So I think it was a Saturday, actually. Yeah. And he brought me into the surgery center. And I watched him do a few ankle arthroscopies, lateral ankle stabilization. And, a lot of that at that time was over my head. But I came back from that just like, okay, this is it. Let's do this. So my colleague friend who was in Barry and a 4th-year student got me in front of the dean again. And I applied and I've never looked back. I finished my 4 years at Barry and was super active. And,
wow.
The rest is history.
The stars lined up perfectly for you.
It did.
Medicine's loss is podiatric medicine's gain. That's outstanding.
Yeah, absolutely.
And Diana, you are right. I've not heard a story like that before.
Yeah, pretty unique.
Jeff, what was your path into podiatric medicine?
Not as interesting as Diana's story. That was news to me.
I don't tell many people.
Yeah.
They're going to know now.
I know.
Grew up in southern Minnesota, Mankato, Minnesota, and ended up going to Luther College in Decorah, Iowa. I was a biology and athletic training minor for my degrees, and always wanted to do something in healthcare. I originally thought about maybe physical therapy. Spent time with a bunch of different people in the professions, and there was a local podiatrist around the college that I spent time with, and I kind of liked the lifestyle, what he did. He did some surgery. And kind of just fell into it that way. So yeah, my story is nowhere near like Diana's.
There's some commonalities though, and we see those commonalities to this day. Being able to shadow a doctor that you look up to and you like his lifestyle and they're happy. I think that really says a lot because, I'm right in the trenches here at one of the colleges, and every day we do interviews. Students come in and they say they've shadowed MDs and DOs and they were discouraged from entering the profession. They really didn't like what they were doing. And then they go shadow a podiatrist, and the podiatrist has tailored his practice to do the things he likes to do or she likes to do. And next thing you know, they're like, hey, I want to be a podiatrist too. So that's fabulous. Great stories.
Absolutely.
So let's jump on to another part of the podiatric journey. It's residency programs. And oftentimes I try to link our residency experiences with mentorship, because a lot of our mentorships come from that very important time in our career when we're doing a residency training. Jeff, would you mind commenting on that first?
Yes, I did my residency at St. John's in St. John Health System, Detroit, Michigan area. My mentor at the time, he was the program director, was Dr. Stuart Wertheimer. And he's actually who got me heavily involved then with ABFAS and some of the activities outside once we graduated from residency.
Oh, that's fantastic. And so that was a big program when I was at Kern Hospital in the early 90s, of course, Wertheimer, and we did lectures between the programs and things. Yep. And I thought he always was very bright and brought a lot to and tough questions to the residents and expected a lot. So that's a good thing.
Yeah.
Diana, how about you? Residency.
Sure. So we're very fortunate at Barry, as you know. We get quite a few externships or clerkships, as they're called now. You can tell our age when we don't know the difference between externship and clerkship. So my first stop was Westside, and that was early on in June. And I knew I wanted, again, heavy surgery. I wanted to do trauma and X-Fix and all this stuff. So I set up my externships to reflect the programs that I felt were, the top of the mark in that area. As I started going through my externships, I kept comparing them to Westside. And Westside, I truly say this to every student who's come through, most of the time you just kind of know, you have this sense of home. And that's exactly what I felt at Westside. So I kept comparing every other program to Westside and kept going back to visit. And it was really the mentors that you were speaking about. We had 35 attendings, but the main core of attending, Stephen Spenner, the residency director, Frederick Chussid, Madeline Ramil, Aber Harad, I can go on and on. Marisol Medina, she's a female podiatrist there. They were all just very warm and very welcoming. And I never heard a single negative word about students or to anybody else in the OR. Podiatry we just loved at the hospital. They constantly would ask how you're doing. They would bring you into the office and say, hey, what's going on today? So I felt that really warm feeling and that mentorship that I was looking for. I know what I strive in and what environments I work well in, and it's not in the, pimping 100 times a day and, you got to go look up papers and go do that. Like, that's not me. I want to be taught. And to this day, any resident who comes through Westside can tell you the phrases that Steve Spinner or Madeline Ramil, say to you in surgery, fiber by fiber, and you just hear this soft, soothing voice. So I definitely try to be that to the residents, who are coming up under you and students, because that's truly for me, the learning environment that I work best in.
It's interesting when you're in a positive learning environment like that, it kind of puts education into your blood and wants to make you give back to the profession and teach others. And that's
absolutely
both of you. That's not the first time Dr. Spinner's name's come up in these Dean chats. And and I tell the story about when I was in practice, when I would go get my CMEs, I would actually seek out workshops where Dr. Spinner was involved because I'd always learn things when he was there.
Mm-hmm.
So that's a common theme. So that's great. All right. Well, with that background and that introduction, let's move on to ABFAS, the American Board of Foot and Ankle Surgery. They're one of 2 certifying boards in our profession. And I tell my students at the Arizona school, and I told them when I was in Miami, getting board certified by ABFAS is the holy grail in podiatric medicine. To be surgically board certified gives you opportunities that you wouldn't have otherwise. So maybe the first question I have, Jeff, if you don't mind me asking, what is the significance of board certification? I mean, times change and, work environments change, hospitals change, insurance plans change, but what is the significance of board certification?
Well, I'm old enough to remember where certification necessarily wasn't something that was maybe as required as today. You have your licensing, which is a base competency in your state level, and then certification was, something that was sought after to prove that you had an authoritative, look at what you're doing, one of the experts in your field. I think we still are that. I do know that certification has become more important for students and residents going forward for to prove for insurance plans, getting in hospitals and alike. But I think from an American Board of Foot and Ankle Surgery standpoint, our certification is something that can be held in a high standard, and something that somebody should be proud of if they do achieve it.
Well, that's for sure. When I got board certified, it was like the highlight of my career at the time, because you work very hard for that, gathering the cases and sending them in. And to this day, when I fly through O'Hare and I go by the Marriott where we used to have the exams, I get like I start breaking out in a sweat, because those were high stakes exams, no doubt, and they still are.
I remember those. I did that. I don't know. Diana, did you do those too or no?
That was the first year that they switched over.
See that now I'm dating how old I am.
Well, nobody will ever take that away from us, Jeff. That stressful way of looking at the mirror. Well, so that it is significant. And there's no question about it. And it's a difficult path, but it really does, like you said, it's a highlight of people's careers. And maybe we can talk about, like our students always ask me, I'll do a town hall and they ask me about board certification. And I say, you should always get double boarded. We didn't have that opportunity, Jeff, when we were graduating, or I didn't. And you either went surgery or you didn't. So I always tell our students to get double boarded. There's no harm in getting double boarded. Mm-hmm. And then, but of course, to work towards ABFAS. So what does that pathway look like, and what does it entail? If you were talking to one of my students, how would you kind of give them the elevator pitch?
Well, our pathway would include you take your ITEs while you're in residency. We highly suggest you take your first and second year ITEs, as most residencies do at this point, just as a practice and way to learn our system. You have your third year ITE that you take, that at this point now, if you do well enough on cadet parts of the exam, can count towards your qualification. But we have the foot didactic, foot CBPS, Rearfoot didactic, and Rearfoot CBPS that you take, and need to pass those 4 parts to become board qualified. At which point in time, you pay a qualification fee, you graduate residency, you're qualified, and then you start collecting cases and logging cases. And then we have the case review process, which I do think sets us apart.
Let's go back just a bit. Let's talk about the ITEs. Those are in-training exams that residents take during their training. Can you comment on those a little bit? What do they entail? I mean, is that kind of takes the place of the old board qualification exam we used to take, right? It can. Well,
we still have a part 1 board qualification exam. Okay. And it used to be, to step back again, showing my age, it used to be you had to do a part 1, and you would take that, at the end of your residency in the spring or the fall of the next year. You'd have your part 1, and then you would also take a part 2 plus collect case review. And I believe it was 2020, we were looking at our exam process, and people who passed part 2 and case review, there was a significant high correlation. So we determined that with our psychometrician that really what we need is just case review, and the part 2 was just not required at that point anymore. So then we're back, so we dropped that set of exams. We also at that time decided to allow, if you score a certain level on your in-training exam, your third year, as a benefit, you could apply that score towards a past exam then of the 4 parts if you take those 4 parts.
That's what I was referencing. Okay.
Yeah.
And can I jump in there really quick? Sorry.
Oh, go ahead, Diana. Yeah.
No, so for the in-training exams, the ITEs, you can take them in your first and second years, and your third year as well, as Jeff was saying, Jeff number 2. I know it's tough to remember, but it's really a measurement for residency directors to gauge where their residents are in their training at that point in their first, second, and third years. So the questions reflect the level of training that a resident should have in their first year and should have in their second year. And if they don't score well, then the residency directors know that they can focus on these areas that they may be deficient in. So the questions are didactic and written and multiple choice. But again, they reflect the level of training that a resident at that point should have. So it's not going to be advanced, rear foot and ankle in the first year, because we all know that's typically your medicine year. So they're going to be more reflective of medicine and basic foot surgery. Your second year kind of builds upon that. And then the third year is when we start to get into the reconstructive foot types of questions. So again, they're markers to be used to make sure that we're gaining the knowledge that we should as we go through residency.
That makes sense. And it's a very logical progression too. And then it's got to help everybody, the residents and the directors, as you said. So it really makes a lot of sense. So it's that third exam that if you score well enough, that could count as your board qualifying exam.
And that's something that, Jeff number 2's board had decided in 2020. They were allowing the third year residents, if you did well enough, to count that towards your qualification exam. The hospitals are paying for your exam. So this was a great way to get that paid for. And hey, if you did well enough, that could count towards your qualification. And our statistics show that 76% of the residents in 2023 passed at least one part of their in-training exam. So that was able to be counted towards board qualification. So it's a great benefit for the residents to, again, use to make sure that they're at that level that they should be. And again, this is taken in the fall. So in the fall, we don't expect the residents to score extremely high because they haven't gained that knowledge yet.
Good point.
So,
especially in the Rearfoot, the RA component, because many programs probably are getting a majority of their RA in their third year, and we take that in the fall of your third year. And we knew that as a board voting on that the RA exam might come across as being a little bit harder that way because of the time you're taking it, but it's still an advantage to a resident if they can pass it.
Right. And then for our listeners, RRA means reconstructive rear foot and ankle surgery. Okay.
Correct.
Perfect. All right. So I'm a resident and I did really well on my in-training exam on the third take in my third year. So I'm going to count that towards qualification. What is the path from there to becoming board certified? And just kind of getting a timeline together. And I mean, I have a list of, logging cases and diversity and things like that. But if you don't mind commenting on what you're looking at once you're in practice, what do I need to do to get board certified?
Do you want to take that, Diana?
No, go ahead.
Go ahead. It's a process of logging your cases in the PLS system. They you have at this point in time 65 foot cases that need to be logged, of which 30 have to be a certain category, say a bunion, maybe some trauma. For rear foot and ankle, there are 30 total cases, of which 15 should be either a fusion or a fracture. But essentially, once you have enough cases logged and hit the quantitative mark, we actually send you a note saying that you do have enough cases. If you'd like to sit, you can, and then you apply. I believe it's is it December, Diana, of the year for November. The March case review, or it's November? Mm-hmm. Yeah, for the upcoming case review, which is usually at the end of March or early April when we do case review.
So you submit your cases, and then they go through a case documentation review. And
so your cases are pulled from the logging system, and the 10 cases are reviewed. 10 cases for foot, and if you sit for rear foot and ankle, then 10 cases are also reviewed.
And they're randomly selected. So it's not like we're, anybody's in the back trying to pick out, our worst cases. It's just random selection.
Complete random selections.
And then you upload once you've applied and they verified that you have met the requirements, you upload your cases into a central secure system. And you go through the case review process. And like Jeff number 2 said, in March, you have other case reviewers who are reviewing your cases. And then I don't think you spoke to the CBPS either, Jeff.
No, as far as, CBPS, for CBPS is part of the qualification. Yes. Right. Part of the qualification process, which you get exposed to even in your first and second year ITU too.
Do you want to explain what the CBPS is? I know you're on the committee.
Yeah, it's a computer-based patient simulation. I actually took it. I guess I'm not that old because I actually took it when I was going through. At that time, it was half CBPS, half oral examination. The thought being, though, that it's basically like a case. Just the idea is that you're supposed to, almost like you were in a clinic, and a patient walks in and you do your workup and diagnosis and treatment. I know some say that it feels kind of overwhelming at times. The cases are stuff that we all see in clinic on the committee. They're all cases. They're real patients. There's nothing made up with them. Probably the stressful thing with it is the fact that there's not necessarily a guidance in the test. You get a clinical photo, you get a clinical problem history, and then you can work up through that. You can pick anything you want in physical exam, labs, diagnostic procedures, imaging. You'll come to an assessment, and then you'll have a treatment selection too. to proceed fully through a case. And I would just add something to that, Diana, at all, or?
It's 10, correct? 10 CBPS?
For each part, I believe it is 10, yes. Or it might be 12 with the new system.
The new system, right?
Yeah. And that's something, so again, you would take that at a Pearson Center, just like your other testing, like your didactic.
Sure.
And throughout this whole process, I just want to say, even my own colleagues and friends who have gone through this, process, all the information is so well laid out on the website. If there's any questions or even rumors, there's so many rumors out there, we're all part of it, in every association, every school, but everything is really clearly laid out on the website as far as the process and what you need. And if you still don't feel like you can find that information, you can always reach out to one of us or the info@abfas.org. But it really is a very well laid out stepwise process. And it tells you, this is the first step, this is the second step, what you're going to need, to gather for your cases, what in-training exam entails, what practice exams, to help you. There's a lot of information on the website, webinars and podcasts. You name it, it really is all there. So if anything seems confusing, we always guide people to the website or to one of us.
And I would say we've become more active too in getting out, trying to get the public. Like this last year at the Midwest in Chicago, two of our colleagues they did an entire lecture in CBPS, and it was very well received. Were you part of that too?
Mm-hmm.
Yes.
It was great.
So you were there, yeah. We're going to do more of that.
No, that makes sense, because half of the fear of things is the unknown. So the more
Correct.
people understand what's ahead of them, probably the easier it is. And I imagine, COVID didn't help. And then, all these challenges
Absolutely.
we have all had to do at every educational level in the profession and in medicine in general. So, it's funny because I saw it had to be this spring. There was, it must have been in March, and you were doing case documentation review. And there was a picture on social media of all the docs and all the tables and all the reviews going on. And it looked quite well orchestrated and looked like a lot of work got done that weekend.
Yeah,
it is. It's long days.
It is. Back on with the COVID really affected the case review process. I think Diana would agree with that too, that, so many people weren't able to get into the operating room and do procedures and that. So we've seen the last couple of years has been quite a difference case number wise, but people who have had issues that way though have been able to apply for extensions. We work with candidates all the time on the board to help them out with getting the process started and going and proceeding through.
So question about timing. So if I'm going in, I'm finishing my residency program and I'm board qualified, take the tests. And how long do I have until I need to be certified? I remember for me, it used to be 7 years. I don't know. Is it still the same?
It is still 7 years. And if there's a significant issue with that 7 years, people change jobs, people can't get cases from old hospitals, things like that. That's when candidates can apply for extensions.
And that makes sense because that happens a lot. People jumping around doing different work environments and things.
Currently, the time to certification averages about 5 years. So, you do have the extra 2-year window, but especially as a female in this profession, we all want to have, or not all, but a lot of us have families. And like you said, I moved states twice. So, your practices on average take 1.5 years, 2 years to gain cases. So unless you're in one of those fortunate situations that you get into a clinic that's just, hammering out surgery day in, day out, we all have extenuating circumstances. I was one of those. I've said it on other podcasts. I did apply for an extension. So it's one of those things that you don't have to feel like, there's no other option if you can't get those cases, or if something happens in those 7 years, you can certainly write a letter to ABFAS. You can call first and they'll tell you how to do it. And I don't know, Jeff, you can speak to it for being on the board longer, but we've seen all sorts of requests for extensions. And
oh, absolutely. And I would say we grant a majority of them to help out a candidate, especially with what's happened with COVID in the last couple of years. We even, noting we have a 7-year window. And most hospitals, at least the hospitals around me, and I think a lot do, have that 5-year window. We'll even have candidates that come up in a 5-year window, they're not certified. We'll send letters to hospitals explaining that, well, we actually have 7 years. So they actually, under our realm, they still have another couple of years to get certified to help them out with their hospital boards if they had a 5-year window they couldn't meet. So
that makes sense. And I think it's important to comment on this, because it's not like ABFAS is out to get anyone. They're here to help everybody, right? We want doctors to be board certified, and we want to help them get certified and maintain their incredible practices. So that makes sense. I think I have a philosophy on that 5-year range, though. It's because nobody wants to wait till the end, just in case.
Right.
Everybody gets, if you take it in your 5th year, it just, you can go in there and relax, because you've got a chance if it doesn't work out. So that makes sense to me too. So 7 years, and that's fantastic. So in each of your situations, were you able to get cases right away coming out of residency, or did it take a while? And Diana, you said you moved around a couple times, so it's a challenge. There's no doubt, especially getting the diversity. That's what I'm hearing from residents and young practitioners. So
I was actually very fortunate. The practice that I joined, the podiatrist, actually he was an MD, DPM, but he didn't want to do surgery. The problem is, and this is something that we do here, is getting on insurance panels is really tough. So I was in that group that I had to work underneath the owner of the practice for the first year and a half. So I had over, I want to say 75, 80 cases that I had logged, and I didn't read the website. Again, this is why I'm such a stickler telling people to read the rules. I had numerous cases that I was not the surgeon of record because the owner of the practice was. So I had to go back in and delete all of those cases. I had spoken to Dr. Jensen, who works at ABFAS several times about that. And because I was not listed as a surgeon of record, even though it was my patient, I could not count those cases. And that's just, again, that's a normal process across boards. But it is tough for a lot of candidates, and we do know that. And that's, again, why there's that 7-year window and that ability to get extensions. But, after 5 years, I don't know how anybody else's 5 to 7 years, I don't want to say a lot less likely to jump on surgery, but I do encourage, if you want to pursue board certification, to try to find an avenue to allow you to do that in the first few years. So it's like you said, you can kind of take a break and not worry coming up. But it's really not a tough process to go through. You just have to log all your cases. A lot of people wait till the last minute.
I guess the upside of that insurance situation is you kept your surgical skills as high as possible.
Correct. Yes.
Right side. Jeff, what was your experience coming out of residency?
I graduated in 2002, and I had my case numbers, I believe it was 2005. I actually sat and took the exam in 2006. That's when I became certified. So I was in one practice that was stable for those 5 or 6 years when I initially got out. So I didn't initially have an issue that way. I could completely understand if you switch practices or move in a couple of years, how things could be drastically different.
Absolutely. So shift gears a little bit and talk about your personal experiences. So Jeff, you're in Menominee, Wisconsin. It's outside of the Twin Cities, and it's a beautiful area. How did you land there? I mean, what a great place to practice and live.
Oh, so being from St. Peter, Minnesota, about an hour on the other side of the Twin Cities in Minnesota, I wanted to come back to the Twin Cities, and actually wasn't practicing in the west side of the Twin Cities for the first 5 years I was out. And I was splitting time between 2 private practices, and it just wasn't necessarily one way or another working like it was going to become part of one or the other. And it's a heavily corporate medical medicine area, lots of big groups, and an opportunity came up with Mayo Clinic Health System on the west side of Wisconsin in the Northwest region, which is based out of Eau Claire. So I moved over here in 2007. And so I'm in a large multi-specialty group or hospital employees. We have, I believe, we're the Northwest region for the Mayo Clinic Health System. There's 4 of us that I practice with. 2 of us are rearfoot and ankle. The other 2 are foot surgery. And we have a mix. We all kind of have our own little thing we like to do. But we see everything. Work with an orthopedic group of about 10 or 11 orthopods too. It's a complete multi-specialty practice, and it's worked out well.
Well, that's fabulous. I'm from Wisconsin also, so all these towns and all their unusual pronunciations are common for me. So no worries. It's interesting. St. Peter. My uncle used to run the bowling alley in St. Peter, Minnesota.
Really? Yeah.
Yeah, it's a small
Nice.
world. Small world. Anyways, I'm jealous, because I'm here in 115 degrees, and you're in beautiful Wisconsin in the summer. So that's a great.
If we were only doing this like in January, it'd be the opposite, wouldn't it?
Yeah, but you got to run with it when you can. There's no doubt.
Yeah.
Diana, now you're about to make another move. You're moving back to Florida. You have a long history of Florida. Tell us about that experience in Gainesville, of all places. What a beautiful, beautiful area.
So I'm actually a Seminole. So for me, heading to Gainesville is kind of like a stab. My entire family's making fun of me, but that's okay. No, I, right out of residency, joined like I said, an MD DPM in South Florida who was focusing on a wound care company that he was developing and eventually sold. So I was lucky enough to kind of come in and get the practice up and going, and took it from 10 to 12 patients a week to 40 patients a day, and wildly successful. It was great. And then he ended up selling to another group. So in this time frame, non-competes and contracts are a big deal. And, I had some hurdles to kind of overcome. And I was mentioning this to one of my trauma reps, and I get a phone call from him one day saying, "Hey, I have this awesome opportunity. I know you wanted to get into multi-specialty group." I was a solo practitioner with one other podiatrist that came on later, but he's like, there's a multi-specialty group. There's only one downside. It's in Wisconsin. I was like, ooh, I'm a South Florida girl, born and raised. So, Florida's my life. And I didn't know anything about it. It was actually in Kenosha, and I flew up and met with the other podiatrist who was there, and it was almost too good to be true. And next thing you know, I'm up and moving to Wisconsin and don't have to worry about fighting non-competes and everything else in South Florida, which is pretty tough. And it's a real issue for our young. So if anybody out there ever wants advice about things like that, please feel free. I'll give you my experience. Yeah, I ended up in Wisconsin. And when my contract ended, I realized quickly that hospital medicine, as Jeff can tell you, sometimes can be a little frustrating. It's great, but I don't want to say that I don't follow rules, because I do, but I like to treat every patient differently. So in hospital medicine, sometimes you don't have that ability to. So I ended up back in private practice, and then my significant other, who's also a podiatrist, got a great opportunity down in Gainesville. And next thing you know, we're like, really, this is happening? So I'm moving back to the Sunshine State in 2 weeks. In fact, if I were to turn my camera around here, you see boxes everywhere. But I'm excited to get back to my home state. My sister's an hour and a half away. My family's 4 hours south, and back to the sunshine, like you guys are talking about the cold. This Florida girl's had a tough time up in that snow of Chicago.
Did they turn you into a Packer fan up there?
Ooh, so luckily I'm a Dolphin fan, so I don't compete directly with them. And I had to learn that working in Wisconsin. You don't mention the Bears, you don't mention things, but as long as you're not in the same conference, you're good. So,
when you were talking about the Seminoles and the Gators, Jeff, I was thinking about the relationship between the Bears and the Packers, right?
That's here is, because I live in Illinois and worked in Wisconsin. And every time they knew that I lived in Illinois, the first thing, well, you better be a Packers fan or we're getting up and leaving. It was like, to this day, I can honestly say my Wisconsin people have been my favorite. Anybody who knows me, they're just like you all. They're just nice, sweet, want to work, and just hardcore Packer fans. Just don't piss them off.
That comedian Charlie Berens has some great Wisconsin takes, and
yes, he does. I love it.
That is fabulous. So Jeff, you're on record now. What do you think about the Aaron Rodgers trade?
Well, I'm a Vikings fan, so I enjoyed it.
All right. Yeah. Okay. I'm a Vikes fan too. I like I am with you on that. I've always
don't have a whole lot to cheer about, but yeah, I was raised purple.
This is their opportunity right now. They could do some damage.
We'll see.
All right.
I think it's great.
All right. Back to seriousness here. And what would each of you tell a prospective student that was considering a career in podiatric medicine? Jeff?
I would tell them that the profession's great. To some extent, you can make it what you want it to be. Like you said, private practice. You can be involved in a big group. You can be in a big orthopedic group. You can take all the call you want. You can be in a situation where you don't want to take any call. So you have that avenue. I've always liked it because I've always enjoyed fixing things. I like the surgical aspect of it. I like helping people. I do absolutely enjoy the lifestyle. I've been out now, 20 years? And working in a situation where I work with all the specialists. I can tell you there's some specialties I don't think I could be able to handle and wouldn't want to do. They just wouldn't be my avenue. It's a great lifestyle. I have met some of the nicest people in the world. My best friends are all podiatrists throughout the country. I wouldn't change a thing.
Oh, that's fabulous. Diana?
I would tell you to do you. I feel we're all trained to be one way, and that's not a reality. Not everybody wants to do wound care. Not everybody wants to do diabetic limb salvage. Not everybody wants to do surgery. Not everybody wants to be a general, podiatric practitioner, if you will. I think we all have unique abilities. And I do think we have to be realistic with ourselves and not try to fit ourselves into a mold that we shouldn't fit into. And being real and being honest with yourself, just like I did 20 years ago, with knowing that I wanted to have a family and a lifestyle. And again, wanting to enjoy who I am and what I do and what I can give back to our community and our patients. I would say be realistic with yourself, get trained in everything, pick a residency program that you feel is home, that you feel you would do really well in and excel in, and don't be afraid to take chances. I hate change. My significant other and I were speaking about that last night. I mean, I hate change, but you couldn't ask for more change going from Miami to Chicago and then, Chicago back to Florida, but stay involved as much as you possibly can. I know I've spoken to you a bunch about, I truly believe in each of our associations and what their goal and their mission is. I'm very active in all of our associations. I love every single one of them. I do believe they all work hand in hand. And again, it's a great profession. I love every day of it. And I thank that jerk 25 years ago who told me that I couldn't be a foot and ankle surgeon and that I was too old to do this. So listen to your friends, your family, but at the end of the day, do you and what's best for you.
I like that. And because we do have similar training across the board, it gives us options, right? And when you have good training and you can pick and choose what you like to do, where you tend to have certain talents or desires or expertise, it makes you a happy practitioner. So I think that makes a difference.
I would reiterate, Diana, too, when you have the opportunity to put the work in now, when you do get out, if you have a chance to give back, maybe if it pushes you out of your comfort zone just a little bit, I would highly recommend it. When I finally got certified and was offered a chance to start giving oral exams, it was a time commitment, but things just kind of blossomed from there. And I have bucket list memories and bucket list friends that I've met just by being involved and wanting to give back. And I would highly recommend doing that too.
You took the word right out of my mouth because I was going to ask, what's it like to be part of ABFAS? From the beginning, how did you initially get involved? You were doing some training or exams, but
when I got certified in 2006, then Dr. Wertheimer, who was my residency director, there were some of us in the program that had been involved. He pulled in to help out, volunteer with testing, and that then blossomed into. So I did the oral exams for 2 or 3 years, and then was doing case review. And then was placed on a committee, I think in 2010 or 2011 it was, and kind of just went from there. And it's opened up all kinds of other opportunities too. I've done stuff at the state level, been part of the state board in Wisconsin. It's it can be, it's a time commitment, as you guys know, absolutely, but it's definitely worth it.
Congratulations on being the president. That's just a phenomenal career pinnacle, if you will. So that's
Thank you.
Diana, how did you get involved with ABFAS?
I am determined. My residency director, actually all three of them, Steve Spinner, Fred Chesed, and Madeline Ramil, they were all involved with ABFAS, and I kept nudging them.
Good.
I want to get on case review. I want to get on case review. I want to get on case review. Finally, a call for volunteers came out, and I encourage people to look out for those emails and don't just discard them. APMA has them, ABFAS has them, ABFAS has them. But the opportunity came up for a call for volunteers, and I volunteered for the case review committee and started there. And then from there, I got appointed to the cognitive exam committee. It was a CEC. I think that's what it was. We've changed names a few times. Now it's a didactic review committee. So that's the committee that writes the questions. So I was appointed to that committee, and that's where I've kind of, I don't want to say thrived, but that's where I kind of found my niche. I did work with MBPME through Barry University when I taught there. So I really do enjoy writing questions and being part of that process. So just, I would tell people to look out for those call for volunteers. And if you're getting a no, keep going at it. Keep asking.
Well, that's great advice. And on behalf of the profession, I thank you for all your hard work and all you do for all of us. So many things happen behind the scenes, and people don't really appreciate how it happens, but it does happen, and people are responsible for it. So thank you for your efforts and your expertise with ABFAS.
Thank you. And as Jeff said, this truly is the most work I think I've ever done is with ABFAS and the committee work and, the meetings and, just the board meetings and everything else, but it's so rewarding. I truly do love what I do.
Paying it forward. That's the ticket.
Absolutely.
Well, I wanted to thank both of you for participating on the Dean's Chat podcast. And I just want to let you know, we will be sending you one of these cool Dean's Chat cups.
I was wondering.
Oh, yeah. It's kind of funny.
I wanted to sip from it.
Well, we'll send one to you for sure. So when I started sending cups to people that had been on the Dean's Chat, I started getting texts with pictures. They're holding it, drinking out of it. John Steinberg was in the OR with it. I mean, it was kind of cool. So now when I put this show up on YouTube and on the website, if you guys don't mind, when you get your cup, send me over a text with the cup, and I'll put it on the thumbnail, if you will.
Absolutely.
We'll be sending you one for sure. And thank you again. And to all of our listeners out there, thanks for tuning into Dean's Chat. Whether you're watching on YouTube or off the website, or if you're listening on Spotify or Apple Podcasts, we really appreciate you tuning into Dean's Chat. And we will continue to bring you the leaders in the profession. And Jeff and Diana, hopefully we can do this again down the road.
Thanks so much for having me. Yes.
You're welcome. Thanks.
Thank you.
Bye-bye now. Cheers.